If you feel like your child is having an episode of tonsillitis, then it's important you bring them in to see a doctor. There are different causes of tonsillitis. Most are caused by viruses. So probably 70% are caused by viruses and 30% are caused by bacteria. We call that streptococcus, strep throat. Now, the interesting thing is most will actually get better on their own. So that's reassuring in a way that you can provide pain relief and observe them, and they usually do get better. But as I said, if it's their first episode or you are worried, it's still important to get help and get them looked at. Now, when you bring your child in, we'll be looking at some key things. How long they've been sick for, if they've got a really high fever, if they haven't been eating or drinking so well. The old classic thinking was if they had pus on their tonsils and if they've got big swollen glands, that's important too. Their age is important, so the younger children. These factors I usually put together in my mind to determine which children need antibiotics. Now, I'm not always going to prescribe antibiotics, but if I do, it's usually the children that are most sick and most at risk. My go-to antibiotic for tonsillitis is penicillin, unless the child has an allergy. Some different antibiotics will also work for tonsillitis. We occasionally use a steroid as well to reduce the size of the tonsils. This is decided on a case-by-case basis. As I said, pain relief can be as effective as well. So if in doubt, Panadol and Nurofen are a good starting point.